Dr. Schwartz, why are the number of gestational diabetes cases on the rise, and what should women know about the implications for their long-term health?
Well, we know that the number of gestational diabetes cases are increasing significantly, and it seems to correlate with what's happening across the country in relation to obesity. Because the incidence of obesity is increasing very significantly. It's being well publicized that this is happening in both males and females, and the parallel increase in obesity mirrors very much what's happening with diabetes. In fact, the term diabesity has actually been used in more contemporary lay language because of this correlation. Increased obesity causes greater insulin resistance, and with greater insulin resistance you develop what is called type 2 diabetes, which relates to inability to use insulin or have it effectively utilized in the body. And then with pregnancy you have an additional chemical imbalance that occurs, which precipitates a greater resistance to insulin. And in people who are already predisposed to gestational diabetes type 2, the gestational diabetes increases significantly, and I think there seems to be a good correlation. There's also a family relationship or a racial, ethnic relationship to diabetes, but that's pretty constant. The one thing that seems to be making a difference is the overall incidence and frequency of diabetes. Now, with regards to your second question, why is this important? It's important because if you follow diabetics who have had it discovered or diagnosed in pregnancy for the first time, and you follow them over the next 10 or 20 years, many of them will eventually become diabetic, and the frequency of that has been quoted as being up to about 50%. So it's a very important screening test for patients who have this, to know that after pregnancy they need to be carefully monitored and evaluated and managed through their medical providers to ensure that they minimize the risks of developing this with appropriate diet, exercise, and any other strategies that are relevant in the hands of their primary care provider. But they're definitely increased risk for diabetes in later life.
Thank you so much.
Okay.